It depends a little bit where you go, if you go to Europe or you go to Asia, but overall I think it's a serious risk. If you think about gambling, it's anywhere between 2 and 4% of the general population, adult population. And if you think about gaming, it's probably a little lower and probably go to a little lower than 1% in some countries, a little higher in other countries.
And what does your research tell you about why these groups, such as adults, for example, with ADHD, are at particular risk from gambling and gaming disorders?
Yeah, we don't know it exactly, but we know a little bit more about how people with get addicted to other substances like alcohol or drugs. And there we know that genetics play a big role. Probably something like 40 to 80% of the causes are actually genetic. And there's another 20 to 50% for psychological and social factors. It seems that it's a little similar with pathological gambling and gaming, although we have much less research on that issue, so we would like to know much more about it. But for sure we know already that ADHD plays an important role in people who are at risk for the development either of substance use disorders or pathological gambling or gaming disorders. So if you have ADHD, the probability that you become addicted to gaming is probably a factor 3 to 4. So ADHD, with its impulsivity and its need for reward, that's actually what ADHD kids or adults do have. If you have these kind of characteristics, then you're more likely to become addicted to gaming or gambling.
And how do you now use your research to help prevent and treat this addiction? It's one way to, I suppose, call it out and notice it, but how do you treat it?
Yeah, that's a very good question. Can we treat these kind of disorders? Now, we have much more experience, of course, with the treatment of addiction. I think in the past people would say, once an addict, always an addict, and we know now much better. We know how these disorders develop, we know how the brain is working, and so we developed both a lot of psychological treatments for addiction, and we have more pharmacological treatments, and even treatments where we directly intervene with the brain. So we have these possibilities to treat, and I guess that's the same for gaming disorders. We know already it's for pathological gambling, that we can use medication and we can use cognitive behavior therapy, and we'll see more and more with gaming. The more important question, of course, can we also prevent it? And there's a very interesting thing going on very recently. We know now that children with ADHD, they have a probability to become addicted to alcohol or drugs of about 50%. So 50% doesn't get addicted, but 50% does, which is about 3-4 times more than children without ADHD. We know now if we treat their ADHD at a young age, for example with stimulants, for example with Ritalin, we know that if we treat these kids early enough, say at the age of between 8 and 10 with stimulants, then in adequate dosages, then we can prevent the development of addiction in about 50 to 70% of these kids. So that is a wonderful possibility. And I'm quite sure that the same would be true for ADHD kids being at a high risk of gambling or at gaming.